Welcome to Healthcast, where leaders and experts from Stony Brook Medicine come together to discuss a range of topics, from leadership and strategic planning to patient care and the inner workings of a successful healthcare system.
Welcome to Healthcast. I'm Christy Golden, Assistant Vice President of Operations for the Neurosciences Service Line. At Stony Brook, the Neurosciences includes a variety of departments that focus on brain, spine, and emotional health, leading us to launch the CARE Initiative, which includes all three, plus more. Over the past several years, communities across Long Island and beyond have seen a significant rise in the need for mental health services, especially for children and adolescents. Schools, families, and clinicians are all feeling the impact as demand continues to grow while access to care and workforce capacity remain limited. Today's conversation focuses on how Stony Brook Children's Hospital is responding to this urgent need through the CARE Initiative, a program designed to support the mental health and wellness of school-aged children by partnering directly with K-12 school communities. I'm joined by Dr. Catherine Gallanter, a professor of psychiatry and behavioral health and director of child and adolescent psychiatry, and Susan Wilner, licensed clinical social worker and director of behavioral health strategic initiatives, both instrumental in developing and rolling out the CARE Initiative. Together we'll explore why CARE was launched, how it's addressing critical gaps in services, and what meaningful progress looks like for schools, families, and communities moving forward. Would you introduce yourselves, Susan?
Hi, I'm Susan Wilner, and as you said, I'm the Director of Behavioral Health Strategic Initiatives here at Stony Brook Medicine, and one of my roles is really to work by ensuring that my passion, helping children and adolescents across Long Island, comes to fruition. And so this is a really exciting initiative. I'm really happy to be here to talk about it.
Thank you. Catherine?
And hi, I'm Dr. Catherine Gallanter. I'm a child and adolescent psychiatrist and the director of child and adolescent psychiatry here at Stony Brook. It's really nice to be here.
Thank you both for being here. So I know that the demand for mental health services and addiction services has increased over the last 5 years. Our communities have faced a lot of challenges after the pandemic, the change in the way school services were delivered, students receiving educational services virtually. So what do you think has really contributed to some of those increase in demand?
Yeah, Christy, thanks for asking about that. As you may be aware, and as many may be aware, there have for a very long time been this increasing need for mental health care access for children and adolescents, and this big gap between what we have in terms of providers and clinicians and the need was only increased with the pandemic. And the pandemic also helped to shine a light on this need. So 4 years ago, the American Academy of Child and Adolescent Psychiatry, the American Academy of Pediatrics, and the Children's Hospital Association named this crisis in children's mental health. And unfortunately, the crisis has continued. And in fact, just recently, those three groups came together and once again said that we still have this crisis. I think one of the things that we've noticed is that with the pandemic, lots of kids were stuck at home. And so a lot of the things that they got from going to school, the social interactions, the peer interactions, those developmental supports they didn't have access to them. So I think that also really exacerbated challenges that were already there.
Susan?
Yeah, so, Stony Brook Medicine, I think, has recognized this for some time. And in 2024, we did a community needs assessment across Long Island. And what was identified was the real need for behavioral health services across Long Island. We followed that up more recently with a school survey last summer to see what the schools were seeing and what they felt their needs were, really, for the kids and adolescents that they were seeing. And while the list was long, the first two things that they really needed were behavioral health, mental health, and substance use services for the children in schools. There were, among other things, which we're also addressing, a need for access to neurology or neuropsychology, orthopedics, pediatrics, developmental pediatrics. And so in response to that, the school's desire and need to help their students, Stony Brook Medicine decided to launch the CARE Initiative. And as a result, the Children's Hospital and all these departments are working together to help meet the needs of the kids in schools.
So much work is being done. That's wonderful to hear. I'm also hearing you talk about workforce. And there's been a shortage, from what I understand, in workforce around mental health services and other kinds of behavioral health services. And I recall our provost about a year and a half ago, maybe 2 years ago, Dr. Carl Ledgway, had asked that we embark on a strategic committee that looked at how do we help increase the workforce that graduates from Stony Brook to meet the demands of the behavioral health areas. We have a lot of different behavioral health programs here at Stony Brook, like the School of Medicine. We have the psychiatry program, and we have a psychology program, social work, occupational therapy, et cetera. And a group of leadership came together to try to look at how we could better engage with students, encourage them to enter these fields so that there would be a broader workforce. So can you speak to what you see is happening in the community around this shortage of providers?
Yeah, we work closely with all of our schools. And as a part of that workforce committee, we've identified ways to better engage students. So the School of Social Welfare, as an example, is engaging with the districts further out east, so that we're considering moving some of our programming out east. So there's opportunity for students to have access and enter bachelor's programs, get an associate's degree. We work with Suffolk Community College as well, to help build this behavioral health workforce out east. And I think, Catherine, I don't know if you want to speak a little bit to the residency program that we've added out east to also address some of the dearth of providers the further out east we go on Long Island.
Sure. So Stony Brook several years ago started a new psychiatry residency program, which sees patients further out east in Suffolk County. And in addition, through the CARE Initiative, we'll be having the opportunity to train more and more psychiatry residents, child and adolescent psychiatry fellows, pediatric residents who now have a requirement to do more psychiatry. We'll have the opportunity to use to partner with those training programs. And really, one of our goals is to have more and more people with mental health expertise serving all of Suffolk County. And, so the more that we can train, the more that we can hopefully retain people in our community. Stony Brook's really known as a bastion of mental health education, and we're really hoping to continue that and have more and more people serving those people in our community.
Very helpful. I also understand, too, the School of Nursing has been doing a lot to try to promote nurses to go into this area of specialty, in particular, particularly in expanding the nurse practitioner residency opportunities and also our physician assistant program to train individuals in how to best serve those in need. So there's a lot happening, which is wonderful.
Yeah, and that brings up an interesting point. Not a lot of places have specialized training for nurse practitioners to get further training once they're done with their degree. And so Stony Brook has one of the first nurse practitioner fellowships in psychiatry, and so we're really proud of that. And actually, one of the graduates from that program is working at CARE right now, and so it's an example of how our mission to train people and then retain them in to serve people in our community.
Yeah, that's great. I heard he's wonderful as well.
Yeah. He's fantastic. And actually, one of the things that was most exciting for him, he said, after he finished the program, was joining the CARE Initiative, because he felt the energy and excitement and the passion and the commitment from Stony Brook Medicine about this program, and decided that this would be an opportunity of a lifetime to join something so new and exciting that Stony Brook Medicine
That's
is
great.
doing. Yeah.
Yeah, we'll talk about education a little bit more, I hope, later. But I think another aspect of the education is we collaborate with all of the school staff. And so schools have social workers on staff. They have other people who work around children's mental health. And of course, we're learning from them, but we're also providing a fair amount of education. And so, we're helping to educate or further educate, thousands of school people who work within the school. And we can talk a little bit about that more later if you'd like.
Yeah, I mean,
sure.
I'll follow. If you want now, I can speak a little bit to some of that. I mean, we know that treatment is important, and that's what our partners are really interested in. But what we also know is that prevention is really important, prevention and education. And so we recognize that the value and importance of educating not only the school staff, but also families. So we have a few things that we've done with the CARE initiative other than just the treatment arm with all of our providers. But we provide monthly education for the staff in all of the districts that we partner with. And they can invite anyone who is relevant to the conversation or they want there. But it's been primarily the school psychologists, social workers, some teachers, administrators. And we have topics that we're educating them on so that we can help them better understand what's happening in the classroom and in homes and how they can best support students. We also have a newsletter that goes out. It gets pushed out to everybody in every district with more information in it, not just behavioral health, but medical. There are articles about the flu or what season we're in, orthopedic, sports injuries, et cetera. And then the other thing is a monthly parent workshop. And that's one night a month where parents from every district can come and hear more. And it's the same topic. We like it to be thematic. However, it's more geared towards parents rather than professionals. And so we feel that sort of multi-arm approach to helping children is really most helpful and really adds to what we're doing in the therapeutic environment or the medical world. This just helps people better understand what's going on with their children. I think that one of the things the schools and parents alike have really asked for is to help them understand better what's happening. And that's our goal as a large academic medical center, is also on the education and prevention piece.
Thank you. So I know that this initiative was very strongly supported by our senior leadership, Dr. Todd Griffin and Carol Gomes, our CEO. Can you just tell me a little bit more about the CARE initiative itself and what types of things that you are doing now, in addition to the educational components and how it's working?
Sure. I mean, so to Susan's point and to your point also, right, any good partnership with schools should include a prevention piece and an education piece. And so we've already heard about Susan for that. So thank you. And then I can tell you a little bit about some of the clinical aspects. So what we provide, we provide both mental health access, but then also access to other aspects of care at Stony Brook. So access to concussion help, access to orthopedic help, access to neurology, neuropsychiatry. But I can tell you a little bit more about the child and adolescent psychiatry mental health piece, because that's the piece I have the most to do with. So we provide assessment, short-term treatment, and then linkage to service if further services are needed. So we've already, I guess we're anticipating being able to serve hundreds of students over the course of the year. And what I will say is, because we're partnering with 7 school districts, that's providing access to mental health care for over 12,000 kids. And what families have told us and what schools have told us is that oftentimes one of the biggest challenges when you identify a mental health need is getting a child linked to care. So, there are long wait lists, or parents, can't find anybody through their insurance. And so I think one thing that we find is so meaningful about our program is that we can provide care for students immediately. We provide same-day, next-day treatment when needed, although sometimes families, for whatever reason, want to wait several days to find a time that's more convenient to them. The other aspect of that we have is, we really are focusing on access. So one aspect of access is trying to get the care closer to where the families are. That means we have multiple sites all over Suffolk County where families can come in, bring their kids in for care. And that's to try to get the care as close to where the families live as possible.
Yeah, and I'll add a couple of things. So we also are able to provide services via telemedicine. So if a family has transportation issues or scheduling issues, we're being as innovative as we can in where the care is, so that we can get the care to students and their families when they need it, where they need it, and how they need it. And the other important point is that it's regardless of payer. And I think that's really important, is that nobody, whether they have insurance, whether uninsured, underinsured, we will see them and they will not be turned away. And we will then help link families to get those resources that they need. But it's interesting because I think the most exciting part is sort of the interplay of all of our departments and the real commitment from the Children's Hospital and every department. And just as an example, we had a student come in who it was referred for depressive symptoms. And our psychiatric nurse practitioner saw the student and we started treatment. But he also identified that in the last 2 months, that student had 3 concussions, sports injuries at school, and they had never even known where they could go or be linked for services for that. And we were able to get them in in the concussion clinic in the Department of Neurology within a week to meet with our doctors there in addition. And it's really exciting how everybody is working together to get students what they need. So it's been really exciting to watch it, sort of come to life.
Mm. I really love the way you talk about the partnerships with the schools too, because it's the first year that this is launched and you're already partnering with 7 school districts, and they have, from what I understand, they've been fantastic. They're receptive, they're responsive, they are letting us know what they need. We're course correcting when they ask us for something that's of value to them. And it sounds to me like they recognize the value of this as it affects the students' learning and their ability to do well in school.
Yeah, Christy, we meet with every district on a regular cadence. It's usually monthly or biweekly, and then as needed in between. But we just met the other day with a school district, and they expressed not only their gratitude, but how excited they were that all of a sudden they're really able to have a place to send these kids, and that the families are excited. And they're struggling with right now with school avoidance and some kids who may struggle to graduate this year. And they really feel that the partnership with us is helpful in them motivating some of these kids to do better. And as a matter of fact, have asked that we join some of their meetings in the school to help staff brainstorm ways to engage kids better. And so the feedback from the schools has been really very positive.
Okay. A couple of things I was thinking as you were talking, two main points. One is that in developing this program, it really has been a back and forth with the schools. So we opened our doors in September, but all of last year we were meeting with the schools because we think that any program that's a collaborative program should really be done in collaboration. And so as we proceed with the program, there's a lot of feedback back and forth, what's working, what's not working, how can we make changes, et cetera. So I think that that's one piece of that real effort on collaboration. The other thing I wanted to mention was connecting families to care. We've definitely met with a lot of families who've said to us, oh, we're so grateful that we can come in to see you, that you were able to see us so quickly. I've been trying to navigate the system, and get my kid in to see somebody, and I haven't been able to do that. And so, that's very rewarding. As a child and adolescent psychiatrist, I know how long the wait lists are, and what we've really been able to do is allow families who have children in our school districts get into care so quickly, and that has been really rewarding and hopefully has prevented more negative outcomes.
Yeah. And can I add one other thing?
Yes.
We also recognize that all of these school districts, while their student population, the demographics may be different, they're all really experiencing a lot of the same things in the schools. And so we recognize the value of them also working together. So we're hosting a symposium for all of the districts who partner with us. And our hope is to do that a couple of times a year, where we're bringing them all together with us. And we have a topic that we'll talk about. And we've discussed school avoidance as something that a lot of schools are struggling with. And then they are going to get together and share things between themselves to see if there's some ideas that they have that another district didn't know about, or just to really be able to say, oh, well, we're not alone and we're all struggling with this, and maybe together as a system, we can find some solutions. So we're really excited about that. That's coming up in the next month or so.
And I think the one of the ideas behind that is just that we all learn better together, right? It's a very much a commitment to learning from each other. So when we've gone out to schools, sometimes because we've done a lot of the educational program will go in person to schools, and I'm often so impressed and pleasantly surprised by the commitment amongst the school staff, the knowledge that they bring to working with kids, and we want them to be able to all share that amongst each other and with us.
When you talk about the schools too, and Stony Brook collaborating, there's been a very long history of being involved in initiatives on the East End, the South Fork Behavioral Health Initiative, North Fork Behavioral Health Initiative, and the schools were a significant reason why those initiatives were launched, because for decades probably they've been looking for solutions when children and families face these situations, and they've partnered with a number of community organizations along the way to try to help improve access. The county, the townships, everyone was really working together in these initiatives to make things go forward. And I think that the Stony Brook has been listening for a while, trying to better understand what the needs are, and our commitment to the community. And being the academic medical center in Suffolk County, it's really, we've been able to now work with them to respond to those needs, to say, okay, we're hearing you. We're going to increase the number of locations. You mentioned that before, the ability to train residents and individuals further east so that there's the demand can be met, as well as locally and in Western Suffolk, that the services are now available in a variety of sites. So in terms of the communities themselves, how do you feel that it's impacted the communities?
So, I think you brought up a couple of really good points. One is that there are other community providers. And I think it's really important. We are part of a community, and we recognize the need to collaborate with our community partners also. And so when we're referring children and adolescents after they see us to something more long-term, we've formed and continue to form relationships with other providers and individuals in the communities. And I think that's really important, that we recognize that we are all a part of one large community here on Long Island, and that we need to all work together. And I think that that's really important. The community, our feedback that we've gotten from the communities has been great. They're really excited to hear about it. I think what excites them the most are the locations that we've chosen, and we were very careful about the locations we chose, that we chose areas where the need was real, where there weren't as many other services available, and where they could access some transportation and things like that. So the response that we've heard has been, I mean, it's been amazing. It's been so rewarding, really, honestly. Catherine, I don't know.
Yeah, I think for a very long time, Stony Brook has had collaborations with schools, but that in terms of access to care, the consultations that we were able to provide were based at Stony Brook. And so I think the fact that we're now expanding further out east, expanding our to different sites, I think is incredibly valuable, because a lot of the families we work with, they have multiple demands, right? Multiple kids, multiple jobs, and coming all the way to the medical center can sometimes be a challenge. So being able to open up centers closer to where the families live, closer to where the schools are, I think has been a really valuable part of our of the initiative, and I think we've been able to do that due to the leadership support.
Yeah, and it seems like the Lake Grove Advanced Specialty Care and the Comac Advanced Specialty Care really have also spread that access to an even greater degree.
Yes. I mean, they have a location there, which is great, and all the way out east as far as Wainscott. So that's really exciting.
Yeah.
You mentioned before about education and being able to ensure that both school personnel and parents and families have access to information. There's a newsletter. Can you tell me a little bit about the newsletter?
Yeah, I mean, the newsletter is thematic also with what our talks are. And in that newsletter, we have topics that are relevant to what our speakers are doing each month. But then there's other things. And I think I had mentioned earlier that we have we put in the newsletter things that are relevant to the time. Flu season, right? So now we have a pediatric expert speaking about flu or sports injuries or, we have a whole host of things planned. And it gets pushed out from the schools. We write this newsletter, and every month the schools push it out through some electronic magic that they have to every family in their district. And the parents love it. We've gotten feedback. And as a matter of fact, the school's personnel keep asking, can we push it out to our school personnel also? Because it's so helpful. So it's been really well received. And, and then it also has the links to the parent workshops and things like that so the parents can do that. And all of our talks and workshops are recorded and will be housed also. So if people can't make it, there are links to where they will be able to access those as well. So if a parent wants to go back to something or wasn't able to make it, or a school social worker wants to go back to remember what we talked about when we spoke about, some topic that was of interest to them, they can go back to that. And we've even had topics and newsletter topics that are in Spanish and English. We did a whole presentation that was in Spanish and English for parents. And so we're really trying to make this as accessible as possible to everybody. And I think Catherine said it earlier, but I think the general theme to the CARE initiative is about access and making access easy where people need it and for what they need. And I think that's really the general theme about it.
Catherine, what can you say about the impact of early access on the long-term health of youth?
I'll use an example which ties together a lot of the things that we're offering. One of the challenges that we've faced after, coming out of the pandemic is kids not wanting to go to school. And we know that for school refusal, the earlier you intervene, the better. And so, we had some of our earlier education programming was about school refusal, about how if a child is really having a hard time going to school, it's so important for them to at least attend, for the schools and the families to work together to get those children in. And we've had a lot of success actually already with some of our students who've really had a hard time getting into school, to slowly but surely get them back in. But if you have a younger child who's beginning to show some hesitancy to go to school, doesn't want to go to the school, so in the morning they're crying, they're complaining, they have a stomach ache, they don't want to go into school, and at that young age, if we can kind of help get them back into school so that they're not a 15-year-old who has been, sitting at home for day in, day out, not going to school. The earlier you intervene, the better. And I think the schools know this, but they're not sure about how to do that, how to implement it. So that's one of the, a really nice way that we've been able to partner, and kind of do some early intervention. But there's so many other examples about how the earlier you intervene, the more you can prevent newer problems to pile on, because each problem puts you at risk for another problem, and we're really working hard to try to get in and intervene as early as possible.
Mm. You mentioned the topic of school refusal.
Mm-hmm.
So I know that, Susan, you said earlier there's a variety of topics. How did you decide on what those topics were?
Yeah, so in talking to the schools, so we did a school survey also, and then in our work the year prior to even opening, as well as these ongoing conversations, we're asking schools. Really, we're not deciding the topics for them. One of the things that we realize is that what's most helpful is what they need, not what we think they need. So we're asking them. And school avoidance is something that comes up time and time again, but we've asked for what they need. Burnout, for example, was something they talked about, burnout in staff as well as students. And so we made that a priority topic for our last month. Screen time is another thing. The parents really struggle with taking their phones away from their kids and the struggle they have with their children. And some parents even talk about being afraid to take it away from them because their children act out or get angry. So we've had a lot of presentations, and we have experts who spoke to that and spoke to families about that. We've had experts come talk to the schools and parents about brain development and screen time, what it does to the developing brain prior to a certain age. And so we've asked the schools where their struggles are, and we've responded to that, really.
You know what I love about Stony Brook, too, is as an academic center, we have expertise in everything you could possibly think of. So it really gives a wide variety of options. If a school district would like a talk on anything in particular, it's very likely that we have the academic capability of delivering that education.
Mm-hmm.
So that's good news. So what do you think are the next steps? What do you hope to do in the next year?
Grow.
Yeah.
Provide access to more kids in more districts. I mean, we're really open to growing to more districts. 7 was great to start, and we're really excited at the success of it. But we would love to grow. All the departments at Stony Brook Medicine and Children's Hospital are very involved, and so we're working with all of them to improve the reach we have to all different specialties. But we'd be excited to have other districts add and join us so that we can provide access to more kids.
Yeah. Yeah, I think that's our main direction. And I think working with the schools, we get so many exciting new ideas. There's some things I would love to do. We'd love to work with the schools on some screening. And I think now that the schools know that they can, one of the challenges for when you with screening is that sometimes, and when I say screening, I mean like screening for mental health concerns. One of the challenges with screening is that you worry that if you screen and you find a child in crisis, you don't know where to refer them. But we already have that relationship, and I think once you have a relationship, you can start to build trust, and it allows you to be a little more innovative. The other thing we're trying to do, we're very carefully measuring how we're doing, like in terms of, how many kids we see, what's the time it takes to connect a child to care, within our system. If they need further referral outside, how long does that take? And so The other thing that we want to continue to do is measure our efficacy, measure our outcomes as we continue to grow.
Mm. And I think the schools realize now that they have our support. So whereas in the past they might not have wanted to do something like a screening for fear of what it would show, they now know that we're really just a phone call away. And Dr. Gallanter especially has been really responsive. If schools have questions or we have difficult cases, we work through with them and help them. So I think them knowing we're here and that we have their back has really helped them want to do more in the prevention area too.
I think our Department of Pediatrics too, our Children's Hospital, has been so wonderful about this too. They are doing screenings. They are engaged with psychiatry. They really want to focus on the wellness of the children in our communities to make children in Suffolk County as healthy as they can be. And that being the Children's Hospital in the county is just a testament to the dedication that our staff and faculty have towards meeting the needs of the community. So I'm excited about the idea of expanding, and I know that our Children's Hospital is excited about that as well. So in terms of next steps for the future, how do school districts get in touch with you? How do they know how to reach out?
Yeah. So for districts that are contracted with us already, we have a really solid process set up. They have a form that they fill out online. It's very short and simple, gives us some basic information. That gets sent over to us, and we address that. We triage those forms usually within 30 minutes for them to refer a student over. And then we contact families, we set up appointments, and we stay in touch with schools along the way. We consent for, that we can speak to all the providers. And very often we find it's Stony Brook pediatricians who are already treating these kids, et cetera. But the other interesting thing is that families in districts that are contracted with us, they can call us also. And we do have a phone number that they can call. So a family can self-refer, and we have had that happen once or twice. What we haven't had happen, but we can, is students could also call and refer. And so all those numbers and contact information are on our webpage and in our newsletter and get pushed out to families all the time. So anybody in those districts can refer anybody.
These are the contracted school districts.
With contracted school districts, correct.
What happens if a school district is not yet contracted for this? How do they get access?
So we have an email address where they can email us, and we're happy to talk to them. We monitor that all the time, and have had many conversations with other districts since we've opened. Or they can call. We have a phone number, a dedicated phone number also, and then they would get in touch with Dr. Gallanter or I, and we could follow up and talk to them about the contracting process.
Thank you. Dr. Gallanter, do you have any last thoughts or ideas that you want to share?
Oh, just that it's been such a pleasure, working with you, working with the Children's Hospital. We're really trying to build up this program. It's being able to provide more access to children and adolescents and families in need, and to support the schools has been a really wonderful initiative, and it's been great working with you guys on it.
Thank you. Thank you both for being here today. It's really exciting to hear about this, and I think that it's just another example of the efforts that Stony Brook Medicine, Stony Brook Children's Hospital, and all of the affiliate organizations are making now to really meet the needs of the community. So thank you again for your time today.
Thank you.
And thank you to you, our listeners and viewers, for tuning in. If you'd like to learn more about how to get your school involved in the CARE initiative, visit the URL on your screen. And if you found this conversation interesting, please like and subscribe for more content just like this.
Stony Brook Medicine is Long Island's premier academic medical center. We transform lives through scientific discovery, education, and care, and we bring together innovative research, advanced education, and extraordinary healthcare expertise to set the standard for how healthy communities thrive. For more information, visit stonybrookmedicine.edu or follow us on social media, Stony Brook Medicine on Instagram, Threads, Facebook, YouTube, and LinkedIn, and Stony Brook Med on X.